Here in the Piedmont Triad, we're all connected by the ideas, innovations, and people working to improve our region, from transportation and planning to housing and economic vitality. We bring those conversations to you. Welcome to the Triad Regional Connections Podcast, hosted by Audra Adams and Lamar Powell, brought to you by the Piedmont Triad Regional Council. Hi, and welcome to Triad Regional Connections Podcast. My name is Audra Adams, and today on this edition, we are going to be talking about fall prevention. And I have three beautiful guests with me today. To my left, your right, this is Christina People. Welcome.
Thank you.
You're so welcome. And then this is Megan Edward Collins.
Hi.
Thanks for being here.
Thank you. Excited to be here.
And then here is I knew I was going to mess that up. Sara Miligarese.
That was perfect.
Was it?
Except for the first
time. The first time wasn't.
Yes. Thank you for inviting us.
Absolutely. So I'm going to start over here with Christina. Tell me a little bit about what you do, how you got into it. Just give us a base of what we are going to learn about today with fall prevention.
All right. So I'm a health promotion coordinator at the Piedmont Triad Regional Council Area Agency on Aging. I oversee our evidence-based workshops. So we have one workshop that's related to living healthy with diabetes, and we have a workshop related to a matter of balance, which is fall prevention. And we serve 12 counties. So throughout our 12 counties, we offer these workshops.
Nice. And how did you come to even know that a program like this exists or that you wanted to work in this field?
Well, my background is gerontology. I received a bachelor's in gerontology at Winston-Salem State University. And
For those who don't know, tell us what that means.
Gerontology is the study of aging, just simply put. So a gerontologist is going to look at the, physical changes, the social changes, financial changes, all of the different things a person goes through as they're getting older. And they look into different programs or services that could enhance that person's aging experience.
That's so amazing. But what made you that interested in that? Did you always know that was something you wanted to do?
Honestly, yes. Not be a gerontologist, no.
Okay.
But growing up, I had a lot of exposure to older adults. I used to volunteer at nursing homes as a kid. So I always knew I wanted to work with older adults. I just didn't know how that would look. So, yeah.
I had a similar experience growing up with much older generation, and I am just in love with it. It was just a wonder to me, the wisdom that they had, and I kind of felt like I was getting a cheat sheet on life a little bit, if that makes any sense. So anyway, I get it. I love it. I didn't know there was a field of gerontology, and maybe that just shows my ignorance, but it's just the truth.
No, it's a lot of people who don't know. So I'm glad we're defining it and sharing that now.
Yeah, absolutely. Now, let me know, Megan.
My name is Megan. I'm an occupational therapist. We work with individuals across the lifespan, from birth to end of life, and helping them be able to do as much as possible those things they need, want, and have to do, whether it's dressing and bathing, cooking, cleaning, driving, getting out and about in the community, things related to work, school, in all different settings, just to help them be as independent and functional as possible in those things that are meaningful and relevant to them in their daily life. And really, when I came to Winston-Salem State, I'm in the occupational therapy department there. I've been there since January 2011, and I was working with some of my OT and physical therapy colleagues there that I kind of became involved with fall prevention and saw, the importance of it, particularly with the older adult, and the impact that it can have on quality of life. And it really hit home when I started doing this, and I talked to my mom, who is in better physical shape than I am, quite honestly, in her 70s. And I said, "You don't worry about falling, do you?" And she said, "Megan, that's my biggest fear." So that really just kind of reinforced to me the importance of this work. And I've been honored to work with Christina, Sara, and many other colleagues in this endeavor.
I can't wait to see how this all connects. But Sara, go ahead and tell me your story.
So I'm a physical therapist, and we work hand in hand with occupational therapists to help people live more independently and move better. So physical therapists tend to focus on improving movement pathology. So any reason why someone from birth to the grave might not be moving in a way that would allow them to live their best life. And I have been at Winston-Salem State off and on since we started a PT program since 1993. So I am a RAM. I am not a graduate of WSSU, but I feel like I should be. So I'm very excited to be involved in fall prevention at Winston-Salem State and with Christina in this area. And it's a passion of mine because my mother passed away about a month after having a serious fall and being misdiagnosed and sent home from the emergency room. They said, she was fine. And really just a few weeks after a pretty serious fall in her home at an assisted living facility where she had assistance, she just didn't survive. And so that's made it a passion of mine to try to speak to community groups. I speak to the Live Strong Cancer Survivor group at the YMCAs about fall prevention. And then Megan and I were on a grant together through the National Council on Aging from 2019 for about 4 years through COVID, which was crazy. We helped provide programs to help prevent falls with the Piedmont Triad area on agency. So we've really been a team for, almost 10 years.
That's a long time.
It's getting close to 7 years. So we want to make the Triad a safer place for older adults so that they can live a long and happy life.
Well, I love that. And we're going to get into how you do that. So now we're going to go to you, Christina. What is fall prevention? And why are we talking about it? I think that part of it, we've already answered why we're talking about it. But what is fall prevention? How do you just foresee in the future or equip people to, be more steady and not to have stories, like Sara has?
Yeah. So fall prevention, when I think about it, it's just different measures that we take to prevent or reduce our risk for a fall. So that's exercising, doing lower upper body strength exercises, stretching. It's our eating habits, it's socializing, it's all the things that a human needs to function. Mm-hmm. But these are the things that contribute to reducing that risk for a fall. So a lot of times if we're, in isolation, or lonely, that can lead to depression, and depression plays a role in falls. So doing the things that can, boost our confidence, give us a positive outlook on life, things like that can really be a fall prevention measure.
Well, I think to me, it makes sense because if you're moving more and you're talking more, it just brings more of an awareness of your whole body that is planted where it's planted.
Yeah.
And is that good sense that I'm saying? Like for me, there's sometimes that if I'm not able health-wise to do something, it's more easy to stumble. It's more easy to not be aware of my space and my grounding, I think. Would that be a fair assessment of why this works?
Yes.
Okay, awesome. All right, so then let me ask you, Megan and Sara, but I'll start with Megan. What are the risk factors for falls?
There's definitely many risk factors. Some physical risk factors include just muscle weakness and balance changes that may occur as a result of some kind of condition, illness, or natural aging, or being sedentary, as you were kind of just talking about. Slower reaction time to things that can increase your fall risk. Changes in vision or hearing, if you're not able to see as well or hear as well what's going on in the environment, your balance may be off, more likely to fall. Chronic conditions like arthritis, diabetes, Parkinson's, and some of those pathologies may increase your risk of falling. Dizziness or low blood pressure, pain and fatigue. Medications. It's really important to talk to your pharmacist, your doctor about medications that you take because many can cause dizziness, drowsiness, confusion, and taking many medications at once can also increase your risk of falling. And then the environment, whether it's poor lighting, just clutter, loose rugs, pets. I had one of my cats almost tripped me today. So it's really important to watch out for those pets. as much as we love them. And, stairs can be a fall risk, particularly if they don't have railings or things like that, or not having grab bars around the bathtub, the toilet, things like that. And then just kind of behavioral and daily routine factors. If you're like me, you like to rush and move quickly, that can increase your risk of falling. And it's really, I'm sure Sara will agree to this, really important to use whatever mobility device, whether it's a walker or cane, that's recommended. Not using those can increase your risk of falling. And it's really important too to wear appropriate safe footwear that you're not going to trip over.
Gotcha. What is your thoughts?
Yeah, and I would love to add that the biggest risk factor for falls is just having a fall in your history. So if you've fallen at least one time, you are more likely to fall in the next 6 to 12 months. And if you've fallen and had an injury, so you hit your head, you needed stitches, you broke a bone, you got bruising, or whatever the injury happened to be, but especially if you had to go to the emergency room to get medical care for that injury, then that puts you at even a higher risk for falls. And I really also want to emphasize the point about medications. Megan mentioned taking multiple medications, and it's really not a particular medication. Any 4 medication, research shows if you're taking 4 or more medications of any kind, that puts you at a higher risk for falls. But if you're taking something like for mood or sleep or pain, those have like a double risk associated with them, because again, like Megan said, they can cause dizziness or drowsiness and make it very easy to, when you get up in the middle of the night to go to the bathroom, to not actually move the way you would normally move and to be at risk for having an injury. So that's not a good thing, and there are many, many other risks. Megan, you did a great job of hitting all those.
Well, one other thing I did, you were talking that I wanted to add too, was just having a fear of falling. You may be fearful of falling, and then so you're just going to sit and not move because you think, oh, I won't fall. And then that will, you'll get weaker and your balance will decrease, and that just increases your risk of falling as well.
So what I'm hearing is we need to stay active in all areas, no matter what age we are, but especially as we age, to keep moving and keep being stimulated in our mind, and socialization and all of those things are still important. And I don't know what y'all feel. I feel like from an outside point of view that our aging community nowadays get less visibility, I think, in society. And I could be wrong by saying that, but I just don't feel the innate sense of respect for what they are going through. And the thing is, we all act like we're supermen and superwomen, and we're never going to be in those stages that they are in. And it's so important to create programs like this and to then put them into practice, like I see that y'all are doing. I would be very interested to know how Ptrc came to be involved with Winston-Salem State. How did that come to happen?
I don't know the full history. Sara and Megan might know more than I do with that part. I came in the midst of the relationship, the partnership.
Okay.
We do have a Piedmont Area Falls Coalition, and Winston-Salem State has been our partners for a great bit of time. The connection that we have, it shows up throughout the Triad area. It was mentioned earlier, they do a lot of balance screenings, fall risk assessments, things of that nature. And so it makes sense for us to be partnered, considering that part of our program addresses fall prevention. But Sara might have more, or Megan may have more to add to that.
It really goes back to about 2018 when we started writing the fall prevention grant through the National Council of Aging. And we did some investigation and looked across the state, because there were other regions that had a falls coalition that were part of this senior services network. And there was one here in the Triad, but it was dormant. Mm-hmm. So we put that into our grant to try to help revitalize that. So we reached out to staff at Ptrc at that time before Christina, and they were part of our grant. And so we sort of gave some CPR to the Fall Prevention Coalition and got a little bit more presence online and started having regular meetings. And we try to build partnerships throughout the 11 county areas. It's a little easier with people who are a little bit closer and can come to the meetings, but most of our meetings are virtual so that we include anyone that can get on a Zoom call can join our meetings. And so we have representatives from Atrium, from Novant, from AHEC, from senior services, really the library, a wide variety of universities. Anyone interested in helping older adults have a healthier, longer life free from falls can be a part. There's no fee. There's no dues, nothing like that. Mm-hmm. We just want to spread education. Really, education is a big key to what we're trying to do, is get the right education to the right people with the right style and type of message so that it can be received and then implemented in their daily lives. But it's 8 years strong so far. So, and the Falls Coalition annual sort of bang up end of the year conference is there's a Nat. How about that? Hello, Nat. I must have brought him in here with me, but that's something that we all work really hard on, and it's going on year 3. So we've been an active group for about 7 years, but a really active group in the last three years.
I felt like you had something to add to that.
No, just in addition to what Sara said, part of the grant was kind of revitalizing and offering some evidence-based fall prevention classes, like Otago, Matter of Balance, the YMCA's
the Tai Chi,
Move for Better Balance, the Tai Chi, things like that, just to really help spread the resources that are available.
So help me understand so you have virtual meetings with whomever is part of this situation, and then how did they get that to the elderly? Like, is that offered as a free service? How is that implemented? How do you get it to the people that you need to get it to your target audience?
Typically, the individuals who attend the meetings have their own networks of, organizations or clients who are older, and they will push the information out to their networks as well. That's usually word of mouth is always going to be the way. And then, of course, social media is another outlet where we push that information out. But usually it's word of mouth where everyone's just sharing information with their networks.
And then the senior centers. I think that's a really key mechanism for getting the word out on fall risk screenings and National Fall Prevention Week and all those things through the Area Agency on Aging, through your network, Christina, trying to get the word out. And we sort of spread the word on our campus and then with a few other schools, but really we're the key university involved in this. We'd love for other universities to be involved. That would be great.
That's a dream. So whoever is watching this or listening, it would be great to have, there's several universities, right? It would be great to have them play a role in our Piedmont Area Falls Coalition to get their input, their knowledge, and be able to spread this, especially students who are just trying to figure out what they want to do. Joining something like this can give you another angle of like, I didn't think about working with older adults. A lot of the PT and OT students, they help us out so much. Will they work with older adults in the future? We don't know, but they have that experience in case they want to go down that path.
So, all right, then brainstorming, like no cameras are here. How do we get those other institutions involved, those universities? What do we need to do?
We invite them to help us plan the Falls Expo and get their students to volunteer at some of our fall risk screenings. It's very easy. The tools and the screens we use, anyone can use. You have to be an OT student or a PT student or a nursing student. You just have to be a person who's can stand and read directions, basically. So we could, get them trained, get them involved, And that would be a start.
And I think another way we've disseminated resources and can perhaps get more partners involved is through the Intergenerational Center for Arts and Wellness in Winston-Salem. It's an amazing facility, opened, I think the ribbon cutting ceremony was November 2023. The Atrium Baptist, of course, Novant have clinics. They're literally right across the hall from each other. Solitude School for the Arts is there. The Williams Adult Day Center is there. Solitude School for the Arts. Head Start Family Services is there, and Winston-Salem State School of Health Science has the second largest base there. And that's where we have done a lot of our fall prevention screenings and classes and some research as well. And I think we're just kind of spreading the word among the partners there.
Do you still need funding, or is grants taking care of this? What do we need financially, and how do we get it?
Oh, we always need money. So right now at the Intergenerational Center for Arts and Wellness that Megan just mentioned, our faculty cover a free clinic, but we're really spread thin. And so we can't have a clinic, Monday, Friday, 8 to 5, like most outpatient PT and OT clinics. We just have a Monday afternoon pro bono clinic. So we are looking for grant opportunities where we could fund a full-time occupational therapist, physical therapist, maybe even nurse. I mean, a variety of healthcare providers where we could have a full-time clinic every day there from 8 to 5. We have a 6,700 square foot space that's got state-of-the-art equipment, but we need personnel.
Okay.
Definitely. In addition to staffing, I think too, just financial resources for adaptive equipment that can help with fall prevention, whether it's, walkers and canes and things like that, exercise equipment to build up that strength, or devices to help with your daily activities that, can make it a little safer. Funding to help support that would be really helpful.
And sometimes where PTRC can help with grant writing, or do you look for ways? I know PTRC is always looking for out of the box kind of ideas, which is what I really appreciate about PTRC. But hearing that, is there a way for everybody to join together in this to make it move forward in any type of manner?
I'm sure there is. I think for our program, with the health promotion program, or we call it Age Well program, that's federally funded through the Older Americans Act. Anything that we do outside of that, grant writing is going to play a huge role. We always look into grants that cater to fall prevention or diabetes management, but I'm sure there's also opportunity for us to look into the grant writing again in partnership with Winston-Salem State.
Well, I think that would be awesome. Now, so you've talked to me about some community resources, but you do have an expo that comes up. What do we call that? I think it's called the Fall Free Prevention Expo. Is that right?
The Falls Free Expo.
Falls Free.
Yeah.
See, I need to put the S on.
Yeah, like Sara mentioned, this will be our third year doing this expo. It's grown each year. Last year we had roughly 200 people, including our vendors, in attendance. It's no cost to anyone, anybody of any age, but we really do, want older people to come out, and we have different exercise demonstrations, different speakers. We have a speaker this year who will be talking about the right shoes to wear. And everybody, that's a question that comes up regularly, is what type of shoe should I be wearing, especially when I'm exercising? So we'll have someone covering that, but different speakers, vendors throughout the Piedmont area that work with older adults, food, raffle, prizes. We always have a grand prize. It's a really good time.
Sounds like it. And do you know the date this year?
It'll be Wednesday, September 23rd.
Okay. And where is it held?
At the Intergenerational Center for Arts and Wellness in Winston-Salem.
Okay.
And we'll have physical and occupational therapy students there doing balance screens, grip strength testing. There is a link between your grip strength and your balance as well. So all sorts of great things going on that are free.
So even if you don't come to eat, come get your fall risk screening and your health screening. And the participants leave with a wealth of educational handouts and information. We tend to have some giveaways like grab bars and flashlights and night lights.
The dumbbells
Oh, yes,
Those are
the
always
adjustable cup weights. Yes, those are the favorite, and the hardest for them to put in their car, to carry out to their car. But those are favorite giveaways.
And you may see some famous people there. We've had the mayor there and some representatives.
We did.
So, yeah,
We've
it's pretty amazing.
screened the chancellor, the former chancellor of Winston-Salem State, the mayor of Winston-Salem. Happy to screen whoever comes by.
Nice.
And we're looking for volunteers as well. So we need volunteers to come out and help with all of this. So if you're interested in that, definitely.
How many volunteers is your goal?
That's a good question. Last year, if we're including students, we may have had about 30?
Probably closer to 40.
About 40.
Because we had all 30 PT students from Winston-Salem State plus OT
10 or
students.
15 OT students.
Yeah. So then 50. Let's increase it, right?
Yes.
By 10
50.
and get about
Nice even
50
number.
more volunteers. It would be great if we could get more students involved with this. That would make it more intergenerational, hence the name of the building. But just that exposure, I think, would be really good for students. So, and then also more like long-term care communities coming out.
Sure, that sounds
And
right.
bringing residents to the event would be great as well, because falls are also common in those spaces.
And I would think that would be pretty advantageous to especially like assisted living places. I mean, they have their transportation. They can get on board if, that's just my
Yeah.
wheels turning right over there. But y'all are doing some great work, and you're talking about things that not a lot of people talk about. You're thinking through things that are future forward, and that really help it not be such a surprise as people get older, and to say, you don't have to not age well. You don't have to not
That's true.
age well. I mean, we don't like it.
Some people don't. Some people do.
I like the knowledge of it. I don't like a lot of the other things. Let's be real.
Yeah, it's not always fun.
No.
At all.
It's not.
No, it is not. But your word surprise, I actually experienced myself last week. I was walking up the stairs at work. I had the pants I'm wearing on now, which are kind of flowy. I had both arms full, and I stepped on a pants leg, tripped, got a black eye, hit my hip, hit my elbow. I thought for sure I'd broken something, but I didn't. So sometimes you think, that's not me. I'm not going to fall. I exercise every day. I'm healthy. I take vitamin D and calcium, whatever your health regimen is. Sometimes accidents happen, and they're more likely to happen the older we get. So it's not a welcome surprise, not like a birthday party surprise. No. It's like, oh my God, I think I broke my hips. Yeah. Surprise.
And I think one thing I realized doing this work, the grant work in particular, is the importance of talking to people about it, your family, friends, your healthcare providers, whether it's your fear of falling or if you do fall, letting people know so you can get the help, assistance, support that you might need. Nothing to be ashamed about.
Well, I just want to say thank you all for being here today, and thank you for devoting parts of your life and your work to helping our older generations be aware, and hopefully you're preventing a lot of heartache. Wanted to say thank you for joining us. If you have any questions, concerns, comments, all of those things, we hope that we've provided the resources for you to get those questions answered, and we hope we've inspired you to volunteer and learn more about what's going on here. So with that, we say goodbye. Have a great day.
Thank you.
Rams.
Yeah.